Hi, I guess it's been a little while since I've posted on YouTube. Today is March 3rd. I'm closing in on 8 weeks post-surgery. And it did get a lot better. Shortly following my last update, I was able to drive finally using the Fresnel lens, I guess that's what they call it, on my glasses. And what that did is it bends the light coming in through my left eye to my left eye in such a way as to allow me to make one image. So it took a while for that to work though. When they first gave me that lens, it it would look okay when I first put the glasses on, but then pretty quickly it would split into two. Um, I missed 4 weeks of work in total, which is the longest I've ever gone without working because I have to drive quite a bit for my job. Um, but really, as soon as the stitches dissolved, that was the Wednesday after 3 weeks, I guess. They dissolved. It was really itchy. Um, Shortly after that, the glasses started to work where I could bring it into one image. So that ended up working well. Right now, I do still see double, but it's much better than it was the last time I posted a video. If I look up, for example, and I look in the room, everything looks single. If I stare at one thing, though, um, if it's far enough away, it'll split into two. So that's much better than it was. And in speaking with my surgeon, he said that this is not entirely unusual. It does happen. What he's been monitoring me for is really a couple things to see how my eye is recovering. The redness was still evident at my was it my 7 week checkup. So he was really monitoring that, and then also seeing how my double vision worked out. And he reassured me that it's going to get better, and he's monitoring the measurement, how far I can see and how well I can keep everything together. So it's moving slowly in the right direction, which is a good sign. So I'm hopeful. And I did see one comment somebody posted about being afraid of the surgery. My being out of work really didn't have anything to do with recovering from the surgery itself. It was really just because of the double vision. And if I had a stationary job where I didn't have to drive, I could have worked after a week. It was really the fact that I have to drive for work that made me stay out of work for that amount of time. So if it's something that you need to have done, I wouldn't shy away from it just because someone like me had this kind of experience. I looked at many other postings from people who had strabismus surgery, and most of them said it was really just the trauma of the surgery that took a while to get over, and many of them longer than I experienced. But I didn't see many people at all who posted about double vision. So I guess I'm a little unusual. So my experience isn't necessarily going to be your experience, but I do want to reassure you that it does get better. It is getting better all the time. So hopefully the next time I post, it will be entirely gone. We'll wait and see. I hope that's the case. So thanks very much. And for anybody who has this, I hope my posts are helpful. It's really the only reason I'm doing this, is to share my experience with people who may be experiencing the same thing. Thanks.